work at the Northern Regional Bleeding Disorder Center in Traverse City. And today I'd like to talk to you about cavities and how to prevent them. So we're going to talk about the acidity of food and drinks. So when we talk about getting cavities, we want to think about pH. And pH is the number, it's basic or acidic. And the number 7 is neutral. So the spit in your mouth has a pH of 7 and tap water has a pH of 7. At a pH of 7, the enamel stays on your teeth and stays nice and strong and solid. Every time your pH in your mouth drops below 7 and becomes more acidic, then your enamel opens up and becomes more porous and you get more holes or more cavities in your teeth. So if you think about foods, there are lots of foods, and you can see which ones are more acidic, which ones are more basic. You can even see on there that almonds are better for you than the other nuts because of their acidity level. So when you think about having your meals throughout the day, your pH is going to fluctuate up for food and down for beverages. It's kind of going to go back and forth while you're eating your meal. And then after your meal, your spit is going to bring you back to 7 in your mouth, and that's good. The problem is in between meals, if your pH doesn't get back to 7. So if you think about a whole entire day of 24 hours and you want your mouth at 7 throughout the whole day as much as possible, you eat a meal, it fluctuates, goes back to 7. Then if you're continuing to snack or sip on drinks like a pot of coffee or a 2-liter of pop or a box of candy or a bag of chips or something like that, that's fermentable carbohydrates that turns to acid when you eat it. If you're snacking on those things between your meals, then that whole time you're not going to be at 7, you're going to be way down here, and your mouth never has a chance to get back up to 7, and you're going to get a lot more cavities. So the idea is that for your whole entire day of 24 hours, you have your breakfast and it fluctuates, and then you pause and you have nothing but water until your next meal, until your mouth is at 7 that whole time, which is wonderful. Then you have your next meal, lunch, and it goes up and down, fluctuates again with your pH. And then if you have nothing but water again until dinner time, your next sit down, eat a meal, drink your drinks, and be done with it, start to finish mealtime, then your mouth has a chance to go back up to 7. Same thing when you're sleeping at night. As long as your teeth are nice and clean and you go to sleep at night, that whole time you're sleeping, your mouth should be at a pH of 7. Now, some people take heart medications, diabetic medications, blood pressure medications, and those things can cause dry mouth or xerostomia. And that means you don't have the proper amount of saliva to keep your mouth at 7. And so those patients typically will get more cavities because it's harder to get their mouth back up to 7 and they constantly have to drink things. So remember, you want to keep your pH at 7, so drink water in between meals. If you need to get up and drink at night, make sure it's only water. There's products like Biotene out there that are saliva substitutes. Most of my patients prefer the Biotene gel. You put a little bit on your finger and rub it up all along your gums, and then you go to sleep at night and your mouth stays nice and moist and healthy while you sleep. So it's really important to keep your pH at 7. So when you think about the options that you have for your food and drink, if you're snacking or sipping on things throughout the day, you're putting your teeth at risk every time you drop below 7. So we have tons of charts here with all different beverages. You can see here 5-hour energy drinks drop your pH down to a 2.8. We have Monster energy drinks. Those drop you down to a 3.2. Rock Stars, a 3.05. If you go to Coca-Cola, that's a 2.3. Cream soda is 2.9. Dr. Pepper is a 3.6. And now remember, this also has to do with sugar-free drinks. So being acidic is not the same as having sugar. So even if you're drinking sugar-free beverages like flavored water, You can drink flavored water, and it's nothing but water and citric acid is what they put in there for the flavoring. And if you do that, you can drop yourself down here to a 3.2. So even just plain old water flavored with citric acid, either you purchase it at the store, you drop a little lemon slice in, or your own little fruit at home. If you add Crystal Light to it, that's sugar-free. All of those things have flavoring of citric acid, which drops your pH down below 7. And if you're sipping on it throughout the day, you're going to get a lot more cavities than if you were to just drink it with your meal, be done with it, and have nothing but plain old water up until your next meal time. And then the same thing at night when you go to bed. Make sure you last have a clean mouth and nothing but water up until breakfast time. Thanks for watching, and I hope you stay cavity free.